Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers. We are here at the station of Awesome Radio, WECU 107.5 FM and 1570 AM. And we also have Awesome Radio on Facebook. So we are so excited to welcome you to Family Health Matters. We are here every Thursday from 3 to 3:30, again on WECU 107.5 FM and 1570 AM. Awesome radio. So join us today, and I'm so happy to have in the studio with me Miss Earlie Barnes. And she's a registered nurse. She has a master's of science degree in nursing. She's a clinician and an educator. So brings a wealth of knowledge to our program on today. And today we're going to be talking about preparing for the flu season. Everybody knows the flu is coming around, and you've been getting all these emails about your flu shot and getting prepared. So we want to share some tips with you on today about the things that you can do to help prevent you from hopefully getting the flu. So Earlie, welcome to Family Health Matters.
Thank you.
All right, tell us a little bit about yourself.
Oh, well, yes.
Go ahead.
Good afternoon, and thank you, Wendy, Ms. Bridges, for having me on the show this afternoon. It's always good to come on and talk about health topics, because health matters, family health matters. And so, so my background again is education. I've been a nurse for over 42 years. My background was OB nursing, was obstetrics, delivering babies. And then after I got through there, I went to education to teach nursing. So I taught at the community college for 10 years, retired, but I'm still part-time helping out and with the clinical aspect of nursing. So it's very interesting. And so, health is very interesting. All aspects of healthcare, prevention, illness, all that is very important. So just a very important topic today as we move into this flu season, or the viral season, I call it as well. And just to talk and bring some awareness to the community.
Okay. Well, I told y'all she's well prepared for this. And Earlie and I go way back, and she's been a dear friend for many years. So we won't even get into that part of it. But let's talk a little bit about the flu season, or as you said, flu season. So one of the words that we have heard that goes along with flu is influenza, right?
Yes.
And so people sort of use that coincide?
Yes.
Okay. All right. So now tell us, why is it important for this particular time of the year to be discussing the flu?
Well, yes, and we, like I said, we talk about the flu, but I guess I look at the viral season, because there's so many things that can go along with it in this season as we move into the cold season, of the cold season of the viral season. It's just this time to get your shots to prevent flu. So it's just a very important time that people, I say awareness is the key. Being aware, and then prevention is very, very important. How do we be aware of this, where we are, and how do we prevent illness and and sickness, and and getting, might not can't prevent getting it, but we can do some things to minimize it and lessen the effect. And so I think my main thing is prevention. Don't wait till you get sick. Let's do some prevention. So what we can do, what can we do as a community to prevent it or minimize, because it's not going to go away. We know that. But what can we do to minimize the exposure to others? And so that's what we are today. Let's talk about that, just minimizing, look at the word awareness, being aware of the season, and then prevention. And then what can I do as an individual to help minimize and reduce the risk to others, and to our families, to our friends, to coworkers, to whatever. What can we do to minimize the exposure and risk to others?
Okay, great. Okay. Now, I know we had planned on discussing so that we would stay on track, because there's, like you said, it's so broad out there. But let's talk about 12 things that we can sort of pinpoint on that we can help ourselves and our families as far as minimizing or preventing us from getting the flu. So let's jump into this. Those 12 things. So you're gonna lead off Earlie and talk about number one. We talk about sufficient sleep.
You can, yeah, you can lead off if you have time. Doesn't matter. I can go. So yes, we all know that a proper night's rest is the best way to boost your immune system. We've seen countless research articles, countless things been on. Whenever you look at illness, one of the background components to illness is lack of sleep. When you don't get to sleep, your body don't renew itself, it don't regenerate itself. Your immune system gets weak, and so we can't fight off illnesses. So they say 6 to 8 hours of sleep per night is an adequate amount of sleep for that they says research wise. People know, so I can go on 2 hours, I can go on this, I know, but the basic research says 6 to 8. And of course, we're professionals, so we look at research a lot, and it's been tried and true, and it's been said that 6 to 8 hours of sleep is what we need. So first thing is get enough sleep. Okay. And
Yes.
so yes, go ahead.
And yeah, getting enough sleep and adequate, not just like you mentioned, like quick naps, but the sleep where you sleep in the deep realm where you actually your body is having a chance to, as you said earlier, to heal and to provide the different enzymes that we need to help build our immune system. And so that thing of push, push, push is not realistic because your body is tired. And when your body is tired, and people says, yeah, if you don't rest, your body will make you rest, and it'll put you'll get into the need of having some rest. So thinking about actually deliberately making effort to get those 6 to 7 hours of sleep, as you mentioned, and not just going on I'll go to bed at 12 o'clock and I get up at 6. That's going to be enough. You need to have deliberate sleep and peaceful sleep. That's right. Okay, good. So we in order, and also too, what saw some research that said it helps with the effectiveness of the flu shot. Yeah. So if you're going to take the time to get the flu shot, the flu vaccine, then you need to plan to do those things to help enhance that. And one of those things I found through research is getting proper rest. Okay, well, like so that's number one.
I was gonna add the rest comes because when you get the flu shot, you're getting antibodies against the flu. So if you're gonna get the antibodies to work, like you said, the sleep helps boost their immune system, and so it makes it more effective. It makes very good sense.
Yeah. And people, say, I don't need to get the flu shot, the vaccine, but you need to help introduce something into your system that your body has to work with. And so you need to think about, if you haven't already gotten it, think about getting the flu vaccine, because this is the time to get it, because you don't want to come up to having the flu and then talk about getting the flu vaccine. And we know that between December, I think it's December and December and March, our CDC recognizes as the flu season. So we're getting ready to enter into that, even though people can get flu as early, now. But that's the season, the time frame that the CDC recognizes that people they see the most numbers of the flu during that season. So go ahead, if you haven't already thought about it, at least think about getting your flu vaccine. Okay, put number 2. The famous.
Go ahead.
Go ahead.
Number 2 is very important to me. I look at that. Wash your hands. Washing your hands is a single most effective way to prevent passing germs. Don't cost you any money, anything. Just wash your hands whenever you are. Wash your hands. We know that it prevents transference of germs and bacteria from one object to another. So when people are sick, they cough in their hands. When you go and you touch the doorknob, you touch the basket at the grocery store, and your hands. So the single most effective thing is washing your hands. We know that you may not always be near soap and water, but we have those hand sanitizers. Keep that in your car. When you get through going to the grocery store and you push that cart back in, the next thing when you do get in the car, use that hand sanitizer. And so that's better. That's the next effective thing against, next to soap and water. Soap and water is the best, but if you can't have soap and water, you can use the hand sanitizers, which has about 70% of the alcohol in it. So it gives you effective washing of your hands. But at some point in time, they say after about 10 uses of your sanitizer in some way, you need to go and wash your hands. So as soon as you can to wash your hands with soap and water, that's the best way. And remember, you got to wash it effectively. And I think I heard somebody say you can sing the birthday song. And you wash your hands at least 30 seconds to a minute to get your proper hand washing. So make sure you not just go in and rinse it off, but make sure you wash it good for 30 seconds to a minute to get good hand washing. Wendy?
Yeah, and I know I've talked about this to some children before, and it helps pull the family in when
Yes.
you do sing the birthday song. I was at one place and we were talking about hand washing, and we were singing the birthday song while they were washing their hands, and they totally forgot about the emphasis of washing their hands, and they were so excited about singing the birthday song until we were able to get them to wash their hands longer.
Oh,
So
wow.
we have to not only make sure that we're washing our hands, but we're asking make sure that our children are washing their hands. And I like what you said about you know, how much we touch. We touch the doorknob, we touch this, we touch you know, everything. So whatever you touch, you pick up those germs. And so the only barrier, one of the barriers that we have is washing your hands. And I know one thing early to mention too is that you see people with gloves and they wear gloves everywhere. But you have to remember when you have the gloves on, you're
Yeah,
transmitting whatever
right.
you touch to your
Exactly.
gloves. And long as you have those gloves on, you are redepositing
Yeah.
whatever you have touched to whatever area that you touch. So if
Yeah.
you are insistent about wearing gloves, that when you do take them off, then you need to wash your hands so that you don't go back and touch something that you already, you know, have touched. So make sure that, you know, if you're really prone to wearing the gloves, make sure that you're washing your hands. And if you even getting in your car, take your gloves off before you touch things that are going to be personal to you.
Yes, that's a good
Okay.
point. Even when we were in the COVID season, or back season, we were wearing gloves a lot. There was research that shows that you should not wear gloves all the time. People thought wearing gloves all
Hmm.
the time was the way, but actually, what we were doing, like I said, was reintroducing. Because you go to, I
Right.
said, my favorite store is Walmart. You go to Walmart, everybody had the gloves on, handling the money. But once you touch the money, the gloves are contaminated, and you keep using those same gloves, go back in and touch, so you contaminate everybody's money, your money. And so I was telling, I said, it's better if you don't wear the gloves, just use hand sanitizer in between or whatever, because, for a while. So using gloves all the time, people think that's the way to keep it down, but it's not. Actually, you're passing more on to people using gloves all the time. Gloves really were used for bodily secretions, heavy things you're touching. So really, we got into wearing gloves, but really, we shouldn't wear the gloves. So that was a good,
Yeah.
that's the point. Mm-hmm.
Yeah, yeah. So just keep that in mind as you move forward and prepare for the flu season.
Yes, yes.
With exercising, ensuring that you're exercising. And I know everybody says, you know, exercise, weight loss. No, exercise also builds your immune system.
Yes,
What do
right,
you want to
right.
share about that?
Well, it just keeps you healthy, keeps you moving. Again, like you say, just a little bit of exercise a day, walking, moving, it just keeps you healthy. It's a part of a healthy, balanced life is exercise. They say you
Hmm.
need to move every day. So, that's just where we are. But people don't get enough, So we say now, instead of, parking at the closest park a little farther away and walk. Instead of, take an elevator, you can take the stairs. Just do a little bit moving and get up every hour, stretch yourself. I know I have a watch, and every hour my watch is saying, "Hey, need to get up and stretch and give me that stretch and do this." So, those things just keeps your body in communication with itself, and it keeps the body healthy. So exercise is very important.
Yeah, so when you're healthy, then you're less likely to get the flu if your body is healthy. So,
Right.
and what it recommends that we should try to do some type of exercise at least 30 minutes, 5 days a week, if you
Mhm.
can. But any exercise program that you start or you start looking at, make sure that you're talking to your primary care provider to make sure that you're not putting any extra strain and that it's within your system. So, and I like what you said about just moving, period.
Mhm.
It's better than doing nothing at all.
Right, right, and like I
Okay.
say, you don't have to have a strenuous program, but instead of sitting on the couch for 2 hours, like get up and move and walk around your house. Out, that's that. I've seen things that just walk from one room to the next in your own home.
Hmm.
That's moving.
Absolutely.
Taking your feet and moving around, circling your foot around. Just something. Go walk to the mailbox. I mean, whatever is movement. But if you sit all day in that one position all day, that's this detriment to your body.
Yeah. So in conjunction with that would be number 4 would be a balanced diet. So
Yeah.
eating healthy and making sure you're making healthy choices when you eat.
Yes. Yes. Because when you're
Okay.
sick, or the immune system is down, you're not eating healthy, you're not getting adequate protein, nutrients, those things, vitamin D, and zinc, all those things. When you eat, and our foods have natural vitamins in it, that we can have, and then we can take vitamins. But you want to make sure you have a balanced meal so you can have adequate nutrients to your body for healing and for your immune system. So it all kind of works together. The body works on in a system. And
Yep,
work
that's
together.
right.
One thing work on another. It's kind of like, I love the body. I think about how it's so. I'm amazed at the body, how it works, and one thing depends on another, and something else ain't working, and something else breaks down, and something else goes. I was like, oh my God, you need vitamin D, you need zinc, you need this, and if this not working, that's not working. And I was like, the Lord put His body together in a tremendous way, and it's phenomenal to me as I think about how the body works every day and what we need to make it keep working. And if you don't have those essential vitamins and things for your body, it will stop working.
Right, right. And he's made it, so we need to take care of it.
That's right. That's right.
Okay. You touched on this a little bit about covering your mouth.
Yes, yes.
We
Hmm. Go ahead.
Yeah, you mentioned about coughing and covering your mouth, and I get tickled sometimes when I see people who have their mask on and they have the mask over their mouth and it's pulled down under their nose,
Yeah,
and I'm just like, that's defeating the purpose of having
yeah,
half of your face, because you inhale everything that you inhale comes in, whether you inhale through your mouth or whether you inhale through your nose. So if you're
yeah,
going to do a covering, then you need to go ahead and cover. You need to cover your nose and your mouth, and you need to make sure that if you're going to cough, if you cough into something, a tissue, a handkerchief, or people say in your sleeve, but if you cough in your sleeve, you need to make sure that you're washing whatever that
right,
sleeve you coughed
right.
into, instead of hanging it up in the closet for another use. So be conscious of that
I know
when
that's right.
you're doing that.
I think the main
So you
point
want
with that is just don't cough directly on people. Try as much as possible
to.
to do that. And if you do have a constant cough, wear a mask. And that way you're not coughing on people all the time. And during this season, I see somebody coughing all the time. I was like, I want to get away from that person. I don't know what's going on. And they may just have a cough that's
Yeah.
non-contagious, but in this season, people are more anxious about it. They say, I'm not around that person coughing all the time, and they say, oh, I don't have anything going on. I just have allergies or whatever like that. But in this season, people could be more anxious if you coughing around them all the time. So you might well just put a mask on when you're out among public, so it won't draw attention to you so much if you're coughing a lot.
Yeah, yeah. Be okay about it. If you want to wear a mask, but
Yeah,
just
me
wear it the
too.
right way. That's
As
all
I,
we're saying. Just wear it the right way so that it'll benefit you. Don't put one on because you feel like you're out there, and then you have it down over your mouth, over your mouth. You covered your mouth but not your nose. So do what works for you, but make sure you do it the proper way.
I also want to say,
Well,
Wendy, about wearing a mask. We got to really, really be careful because sometimes masks can be a detriment. If you have health issues, asthma,
uh,
COPD, or some things like that, if you always got that mask on, what you're doing, you're rebreathing that air back in. You're not getting fresh air. So what I'm saying is that when you're in the car and no one is in the car, don't wear your mask. I see people riding the car with a mask on. Like, what is the benefit of that?
yeah,
So your mask is to protect you from other people. So when you're in your own home or you in a car by yourself, you don't need to wear the mask. You need to get some fresh air. So if you're always wearing that mask 24/7, you're rebreathing. It could really be a detriment to your body. So don't wear it all the time. Take it down, get some fresh air.
yes. Outside, walk outside, get you some
Yeah,
fresh air outside. You don't need a
yeah,
mask on when you're outdoors, when you're
yeah,
outside, unless you just really outside with a whole bunch of people around you. But if you're outside, take your mask down.
yeah. I just wanted to
We're
say
gonna move on
that.
quickly because we don't want to run out of time.
Okay,
Don't overdo it.
right.
Yeah. So, and I'm a firm believer. If you feel sick, stay home,
Mm-hmm.
because you don't
Mm-hmm.
want to cross contaminate with anybody else. People would prefer your
Yeah,
employees would prefer that you stay home than to come in sick. So please, please, please keep that in mind, that you
yeah.
need to stay home if you're sick.
That's
And you
right.
need
I
to wait
agree.
at least 24 hours before, if you had a fever, wait for at least 24 hours until you know that fever is gone.
Right, right.
Okay.
I do. Yeah.
Talk about the adhere to medications. What does that mean, Early? What does that?
Well, it means that those medicines that you have been prescribed to take
Hmm.
when you if you get the flu, if you go to the doctor within a certain amount of time, you can get an viral medicine. They can give you maybe to lessen the effects. It doesn't really take the flu away; it just lessens the effects of the flu. So it just depends. And what else? Other medicines saying that make sure you know that the doctor knows what you're taking. If you're taking diabetic medicine, heart medicine, whatever medicine you're prescribed to take before you take anything add on, you need to make sure you talk to your doctor. For instance, I say like people with hypertension. You know, you get a cold or get the flu, and the first thing we do is go get over-the-counter medicine. Be careful because some of that over-the-counter medicine can increase your blood pressure. And so when if
Right.
you have illness, you might want to just make sure you just call in on the hotline or whatever to your doctor. Say, you know, I'm this is what I'm going through. Can I take this medicine that I've got off? What should I take? They may take no. They may say no. Take this one. So this like I think that is a blood pressure cold medicine called what's the name? It's one for your blood pressure that they'll tell you to take if you got high blood pressure. I can't think of what the name was right now, but the doctor tell you what to take. So just be careful with medicine. Just
Right.
picking any kind of medicine off the counter to take for your flu and your
Yeah.
symptoms because
And
you
you
can
can
do
use your
something.
pharmacist. You can use
Huh?
your pharmacist as a resource
You
as
sure
well.
can. Right, right,
Okay,
right.
we're gonna jump. We're gonna jump ahead. So we
Yes, go ahead.
uh, let's see, play it safe at the pump. I like that one where it says
Mm-hmm.
that you can
Oh
use
yeah,
the paper towels to use when you do the handle with the gas because if
right.
somebody's been sick, cough, touch the handle and you use that same handle, so use some paper towels or as a barrier.
That's right.
As you said earlier about washing your hands, use that Purell when you get in the car, your hand sanitizer, and Purell your hand after you worked at the pump.
Mm-hmm.
Okay, what else, Bear? What else prevented? Oh, the
Sharing
pen.
pens. Yeah. How often do we at work?
Yeah.
We've been nurses and everybody want to use your pen.
Yes, yes. But I recommend strongly, and I've been trying to be conscious of this, is taking and having a handy pen with me. So
I
when
always
people
carry a
hand
pen
me
with me.
something to sign, I have
Yeah.
my own pen. I sign with my pen, and so I think that so everybody pick a pen, put a pen, an ink pen in your purse or in your somewhere close by that you
That's
can
right.
use, even going to the bank. They
That's right.
provide a pen. That's nice, but everybody's untouched that pen. So bring your own pen. Put your extra ink pen in the car.
Right.
Okay.
Stay,
Um,
um, stay current on vaccinations. That's really big. It's really big.
yeah.
Yeah.
Okay. So one, you talked about flu. We already talked about the flu
Mhm.
vaccine. And this is a whole nother segment when you talk about the pneumonia, the
Yeah.
RSV, all
Yeah.
of those. So that's going to be a whole nother segment. But get with your doctor and your care
Yeah.
provider and
Yeah.
find out what vaccines are significant for you.
That's right. That's right.
Okay. Let's see.
And I like
Early
the
talk about, go ahead.
huh?
I didn't hear you. Go ahead.
I like as we're winding up, you use that said use good sense at the holiday gatherings. We got to be very careful during the holidays as we're around each other. Just be, my word is sensibility. Use some sensibility when you're around your family and stuff. If you're sick, don't go to the family gathering. I know you might want to go, but if you have the flu or you got to go, stay home. And this tell about, look, I want to be there, but I don't want to spread everything to everybody. And so you stay home because if you come and you spread to everybody, and everybody's sick.
That's
So, but
right. That's right.
yeah, and we want to see you, but hey, we can do FaceTime. We can do so many things
That's what I
now.
was just getting ready to say. Yeah, you
Yeah,
can
hello,
FaceTime
how
people
you
now.
doing? Yes, we can do so many things.
Yeah,
So,
yeah.
just I think again, my words was prevention, awareness. Think about what you're doing with other. Think about other people as well. What's going to me how I affect other people. So as you're moving into the holiday season, into the gathering season, to the shopping season, just be aware and be very conscious of where you are and what's going on. That's the big thing. What I think the main thing we can take away from the days is be conscious, be aware, prevent it, and know that life doesn't stop because it's flu season, but we can do
That's
a lot
right.
of things to minimize and reduce the risk.
Yeah, and one of the things too we want to make sure we touch on is stress. We
Yes,
need to try to look at decreasing as much stress as possible in your life because stress, excuse me, it's there. But stress also works on your immune system. So you need to make sure that you're looking at ways, do some things for yourself. Life is
yes,
so busy.
yes,
Find your hobbies that you really like doing, something
yes.
simple, taking
Mm-hmm.
a walk. All of those things can incorporate preventive. for help you from getting the flu. But you got to find time to take care of yourself. We
That's
always talk about self-care, and
self
this is true, but it has to be a reality. We can talk about it, but it has to be a reality. So you need to think
care.
about some things that's going to take care of you as well as trying to take care of others.
That's right.
So we have maybe about another little over 2 minutes, a minute and a half. But Early, talk about some signs and symptoms of flu,
Right.
just
So
really quickly. Just run
yeah,
through them real quickly.
when you start feeling bad, you feel malaise, you feel fatigue, you're sniffing, you're coughing, you're sore throat. I know when I first you get sick, first thing happens is I get this little tickle in my throat and I start coughing. Then my ears started hurting, and I was like, "Oh Lord, it's coming down." I can feel it, and I just know those little signs. So you can tell this little my may have a low grade temperature, or you may start coughing. You feel bad. You just I'm going to go to bed early. Those are some of the starting signs of maybe I'm coming down. But you can ward it off quickly if you go ahead and make sure you drink plenty of water. If get fluids in, get some rest. You might can ward off having it, but stuffy nose, those things like that, muscle aches, headache, those things, that
Mm-hmm.
start happening to say I may be getting sick. Yeah.
Yeah, and that goes back to start doing some of the things that we talked about
Mm-hmm.
earlier, about getting extra rest, and drinking lots of fluids to see
Mm-hmm.
what you can do to build up, your immune system, vitamin
Mm-hmm.
C, adding those things that you may not take on a regular basis. But now that the flu season is coming, why not take an extra vitamin C?
That's right.
Increase your fluid intake so that those things can start ahead of time so that
Mm-hmm.
you'll be prepared, or try to make yourself as prepared as much as possible. And it goes back to if you have the flu or get the flu and you have a chronic illness and you start having signs that's greater than just a regular fever and chills, seek out medical attention.
Yes.
And when you agree, then you need to do that before you get really sick, so you don't end up having to go to the emergency room.
That's right. That's right. That's right. We can do a lot of
So,
treatment at home with self care before we, do that. But if you get sick and you have a fever greater than 100.4, you really, feeling bad and stuff, you need to, call your provider and get seen and get taken care of. Yes.
absolutely, absolutely. Thank you, Ms. Barnes, for sharing with us about preparing for the flu season.
Yeah.
I appreciate all that you've shared with us on today. I hope people will take these pointers and get themselves ready because it's
Yeah.
coming. The flu season is coming, but it doesn't mean that we all have to get the flu either if we try to
That's
take
right.
care of ourselves. So again, I'm your host, Wendy Bridgers. We are here every Thursday from 3 to 3:30 on Family Health Matters here on Awesome Radio. um, 107.5 FM and 1570 AM. Join us next Thursday from 3 to 3:30 on Family Health Matters. Have a great day.